And the Center for Investigation of Sexual Offences and Child Abuse, CISOCA, is calling for greater collaboration between the justice system and the police to send a strong message to perpetrators of sexual offences. Head of CISOCA, Senior Superintendent Charmaine Shand, made the call today as she expressed concern about an increase in teenage pregnancy. She says the problem is more prevalent in deep rural communities. SSP Shand says CISOCA has noticed that some persons in rural areas have been protecting sexual offenders.
Most cases that come to the attention of the police where pregnancies are concerned in those deep rural areas are cases where a child will turn up at the health center, they'll turn up at the medical facility, and that is the first time the police in the area knows. Now, what we know is that the community has a responsibility to report these matters and to stop protecting the offenders. These children are pretty young. We have 13-year-old reporting to Kingston and St. Andrews, CISOCA. That report here, and after medical examination, it is found out that the child is pregnant. It is something that we have to take a stand.
SSP Shand was speaking today on the morning agenda on Power 106. The impact of COVID-19 on mental health in Jamaica is the focus of a study which is being spearheaded by the University Hospital of the West Indies, UHWI. The issue has taken prominence as more Jamaicans who've contracted the virus are showing signs of mental illness. Shamela Pullen has been speaking with a consultant psychiatrist.
Experts say 1 in 3 persons who contract COVID-19 suffers from mental illness. Consultant psychiatrist Dr. Winston Delahaye says so far, the primary disorders seen include post-traumatic stress disorder, major depression, and post-COVID psychosis. Dr. Delahaye says he too has been treating some of these cases.
So a male 60-year-old who otherwise had no previous mental health issue, had the coronavirus, was admitted for 2 weeks at the University Hospital, discharged. Physically, may have had some challenges in terms of breathing issues and so on, but prior to being admitted had no mental health issue. All else was well, except that this person had great fear entering their home. In fact, they didn't recognize their home. They thought they were still in Montego Bay when they had moved to Kingston for over 20 years.
Now, a local study is currently being done at the University Hospital of the West Indies, UHWI, Psychiatry Department, to get a true picture of the situation.
These would be persons who are healthcare workers who have seen it fit to seek help. Of course, as I indicated before, there are increased risk of exposure to the virus and exposure to persons dying. So it's a major challenge.
It's just healthcare workers or people who have, do you plan to include people who have COVID in this study?
So there are other persons looking at other areas, and I think that includes those other persons. For my particular team, it's the healthcare workers who we've been seeing over a year or more. Dr.
Delahaye says the long-term implications can be major. He says this can become quite costly to the government.
If for no other reason, it's in terms of the cost of the healthcare system, the Ministry of Health, being able to project and predict the kind of expenditure. So already we weren't doing the best in mental health, as you're probably aware. Even more so now, we need to beef up those resources.
Shamela Pullen, TVJ News.